Good morning, everyone. I'm really honored to be here in Dharamsala. This is my first time in India, and this experience has just been absolutely wonderful, so thank you. The work I'm going to be talking about today relates to emotion regulation therapy. It's a psychotherapy that my colleagues and I have developed, and it's infused with practices derived from Buddhist mental training exercises in hopes of improving the efficacy of psychosocial treatments. The condition that I'm going to be talking about today is called anxious depression. It is one of what we call the misery disorders, and post-traumatic stress disorder is the other misery disorder. These are people who have tremendous difficulties experiencing their emotions, and they have conditions of the mind that prevent them from making good choices in their lives because of the intensity of their emotional experiences. So the work that I'll be talking about today represents our attempt to accurately describe the profile of a specific patient, this patient with anxious depression, and then to begin to identify a neurobehavioral profile of this individual so that we can develop a treatment that tries to provide specific antidotes to the neurobehavioral problems that they suffer from. And the place that we've looked for these antidotes is in the Buddhist mental training tradition. So on this screen you will see the names of many, many collaborators, most notably my colleague in New York City, Doug Menon, but I've also received funding from the National Institute of Mental Health for the work that I'll be presenting today. So my hope for today is mostly to describe for you, to educate you about what this Western condition of anxious depression is about, to hopefully paint a picture of what we believe is going on at a neurobehavioral level with these individuals, and then describe emotion regulation therapy, this psychotherapy we've developed that we have infused with particular mental training exercises in a particular order that we believe is most suitable to best condition the mind so that they are going to have a superior treatment response. And then hopefully to have some discussion with our monastic colleagues and members of the audience to see if your perspective, being monastics or being here in India, will give me ideas on how best to tailor this treatment even better. So I quickly wish to describe two treatments that are common in the West. There's major depressive disorder. It's a condition where people have a persistently sad mood lasting at least 2 weeks. They may have problems sleeping. They may have problems eating, sleeping too much, eating too much, sleeping not enough, eating not enough. They have a very negative outlook on their lives, and they're behaviorally slow often, and have difficulty motivating themselves. The other condition is called generalized anxiety disorder. These are individuals who have a lot of muscle tension, difficulty in having sensations in the body, but most notably they have a very unquiet mind where they are worrying constantly about the future. They're worrying constantly about matters in their lives, and they adopt a very self-centered focus in the way that they are relating to the difficulties in their life. When these two conditions co-occur in the same individual, this is what we refer to as anxious depression. So just to give you a sense for the burden that is caused in the West by anxious depression, you're seeing a figure on the screen right now where there is a yellow line, and it is across the screen at the number 20. In the West, 20% of all individuals will have major depression in their life. Sometime in their life they will suffer from major depression. But the risk for depression is increased dramatically if you have anxiety prior to the depression. So if you look at the gray line, you will see that the risk for having major depression increases as a function of your age. So once you are maybe 16 years old, your risk for having major depression increases incrementally if you have anxiety before the depression. This red line shows you what happens if you have generalized anxiety disorder, this condition where the mind is very worried all the time. The risk for having major depression is dramatically increased if worry and generalized anxiety precede some depression in your life. So these two conditions seem to go hand in hand, and they confer this sense of misery that I was describing earlier. And from a physical standpoint, these conditions cause tremendous suffering physically for individuals, and they put a tremendous burden on the public health system in the States. So these conditions are very chronic and are the most common in adult. So in older adults in the States, they have a high rate of generalized anxiety and major depression. If they are married, they describe the quality of their marriage to be poor. They have an inordinate risk for having heart disease. So these conditions of mind seem to deteriorate the quality of their physical functioning, especially in terms of the heart. They go to the doctor more than anyone else, especially the emergency service. And in general, they describe their quality of life as especially poor. So what I've tried to do is describe on the outside what these particular individuals look like in terms of what symptoms they have and what are some of the challenges that they experience in their day-to-day life. But I guess the goal of this program of research that I've been conducting is to also delve into whether there are any neurobehavioral characteristics that are signatures of these individuals. And if so, can we derive specific antidotes that would resolve these neurobehavioral problems in hopes of providing a superior treatment response? So in the next part of my talk, I'd like to describe some of our hypotheses and some of the findings that begin to characterize what is happening at a neurobehavioral level for these individuals. So to begin, all humans, all organisms on this planet are governed by motivational pulls. We are driven by the desire to build a prosperous life. So we want to seek reward. And we're also driven by protecting ourselves from danger. So what you're seeing on the screen right now is a savanna from Africa. And perhaps, imagine that you are the antelope who wants to nourish yourself eating the grass and wants to quench your thirst at the watering hole. But just at the bottom of the screen, there is a pride of lions who want nothing better than to eat you. So this organism, the antelope, needs to balance the desire to seek food, to seek nourishment, to care for its young, and not get eaten by the lion. All organisms have situations in their day-to-day lives that are marked by the tendency to notice the desire for reward and the need to protect themselves. And finding the right balance of these two motivational pulls was the definition of harmony that I was trying to provide to you yesterday, and it is a central idea of our treatment. The same goes for human situations. The panel on the left is me, at the microphone, at the podium, with this audience. I very much wanted to come to India and share my ideas with you, but even now that I'm senior in my career, I still feel a sense of anxiety, some fear when I have to address a large audience like you. So I have to find the right balance between my desire to share my knowledge, to share my work, and to manage the fear and anxiety that I feel inside me. Or in other situations, humans may want to socialize, but they feel scared to introduce themselves or to to make themselves known to a group. So each and every day in our social lives, we have to strike a balance between the desire to protect ourselves and the desire to connect with other people. The other aspect of our model has to do with certain qualities of mind. All of us speak to ourselves and relate to ourselves in our mind. We have a conversation of self. We look through the lens of the self as we make decisions about our day-to-day lives. For patients suffering with anxious depression, they have an inordinate amount of self-referencing or self-referential processing. The self is very big in the mind, and it prevents them possibly from seeing the world as clearly as possible. So this is a natural state of the mind, but obviously with certain kinds of practice, we can condition or cultivate different states of mind where the self is less prominent. For the patients that I'll be describing, they seem to have a very prominent sense of self in the context of their lives. So to summarize what I've said, anxious depression, this combination of GAD plus major depression, these individuals have very intense emotions, and they are pulled by their motivations mostly to protect themselves. They are going to privilege the idea of protecting yourself even if the reward is right in front of you. And after this opportunity has passed, they are going to be very upset with themselves for having ignored the opportunity for reward. And they are going to have a state of mind where they are constantly worrying and ruminating and being very self-critical about their shortcomings. When we see this, so once we've identified this neurobehavioral profile of patients with anxious depression, we've begun to inform our work by basic findings in affective neuroscience in hopes of seeing if we can tailor a treatment that will provide a specific antidote to their problems. The basic model of emotion regulation and affect science that we draw from says the following: emotions are functional. Even the negative emotions, anxiety, fear, dread, sadness, they have a functional basis. They have provided survival value over the time that humans have been on this planet. So we may not want to experience these emotions, but at one point in our lives, having these emotions have provided some survival value. They may have saved our lives. Another aspect of normal emotion regulation is that although we have emotions, it may not always be optimal to experience them at their full level in every single moment of your life. So there are times in our lives where it may be proper and judicious to dampen down the intensity of the emotional experience, because having these intense emotions may undermine the effectiveness of the actions we wish to take in a given moment. And likewise, for healthy humans, it is optimal to have a broad and flexible repertoire of behaviors. Just like the animal on the savannah, we want to have good behaviors that help us forage, that help us care for our family, that also protect us from the lions. So we want our ability, we want to see danger when it's there and respond to the danger and get back to our activities. So optimally, organisms will have a broad and flexible repertoire of behaviors. In contrast, the individuals with misery disorders and anxious depression in particular seem to have deficits in what we call emotion generation. So they have the same range of emotions that all of us have, but their emotional tendencies are much more intense. So if we feel a little bit of anxiety, they feel a lot of anxiety. They also have qualities of mind that prevent them from adequately noticing and resolving the arising of emotion in their bodies and in their minds. From our perspective, we talk about this, and we talk about two kinds of emotion regulation. We talk first about what we call non-elaborative emotion regulation, which means capacities of attention. So for individuals with anxious depression, their attention may be drawn to a danger, even if it's small, and they're going to ignore all other possibilities because their attention is focally drawn to the danger. So non-elaborative means that your ability to deal with emotions is compromised mostly at an attentional level and does not require lots of visualization or words or language to process whatever the stimulus is in the environment. They also possess what we call elaborative deficits. These are deficits where they may have difficulty visualizing things in their mind and have difficulty calming themselves with words or calming themselves with some of the practices that we've been talking about, and hence the intensity of their emotions remain, and their quality of mind becomes very worried, very ruminative, and very self-critical. And the combination of having very intense emotions with a mind that is unable to quiet them results in behavioral deficits. These individuals are going to live a life where they spend so much time protecting themselves, not trying to flourish, not trying to prosper, and they are going to pass. They are going to ignore opportunities for reward. They are going to ignore opportunities to enrich their life with, even if it's right there in front of them. So I'm getting short on time. So just to summarize, patients with anxious depression with this profile have deficits in their body in terms of how they experience emotions. They have deficits in the mind in terms of how the mind processes these emotional experiences, and it results in deficits in the actions they take in their day-to-day life. The emotion regulation therapy that we've developed attempts to address all of these problems I've described. We see these individuals as having very reactive responses to the arising of negative emotions, and the approach they tend to take is to adopt a quality of mind that is very worried, very ruminative, and very self-critical, but ineffective at dealing with these emotions and ineffective at making their lives better. So our goals are first to address some of the attentional deficits so that they can cultivate a quality of mind where their attention is more squarely focused on where it needs to be. And then also to teach more elaborative capacities that we call metacognitive regulation, so that they can quiet the mind without worry, without rumination, without self-criticism. And by teaching them these abilities, we hope that they will develop a broader and more flexible repertoire of behaviors that will help them prosper in their lives. So at the non-elaborative level, we first begin to teach mental training exercises associated with attention. We want to teach them ways of creating single-pointed attention, very focused, very sustained, but very flexible, so it can move to whatever stimulus is necessary. This is achieved by teaching them a daily practice, such as attending to the breath, or what we call a body scan, where they will bring their attention and place it in certain parts of the body. And you might think of this as the aperture of a camera. So sometimes we want the lens wide, so lots of light comes in. Sometimes we want the lens very small, so that it's focused on a very small area. So so again, we begin with attention, because the quality of mind that these patients begin with is often very clouded by worry and rumination. So if we can train attention first, we can then perhaps later teach these more elaborative practices later, and that's the goal of our treatment. After teaching basic attention practice, we then teach what we call an allowing practice. The goal is to maintain sustained attention on difficult memories, difficult sensations in the body. We have a practice which is like an open presence or open monitoring practice that are common to your tradition. And then we also have what we call a mindfulness of emotions practice, where individuals are asked to bring to the mind, to visualize in the mind something that is very difficult, but that also has rewarding aspects. So perhaps it's the decision to become a monastic, or perhaps it's the decision to pursue a geshe degree. There's going to be both things that enrich you, but there's going to be a very difficult path ahead. And so in mindfulness of emotions, we want them to see and to notice the arising of both the motivation to approach and the motivation to protect. After they have learned more attention practices, we teach them the more cognitive or verbally elaborative practices. So the first one, and this will also be talked about in Catherine's talk, it's this ability to decenter. This ability to notice that I am not synonymous with the products of my mind. So we want to create in the mind a healthy distance from the difficult percepts of mind, so that they can be noticed, they can be better manipulated, and they are going to have less of an intensity as we work with this material. I'm short on time. So again, decentering is the idea that I can notice the arising of thoughts, feelings, memories in the mind, but I can create some distance in the mind's eye from these percepts in hopes of trying to work with them better and to ultimately regulate the emotional intensity better. One of the practices that we use here, it is a guided meditation from a Western teacher named Jon Kabat-Zinn. And it's called the mountain meditation. This is actually a practice of equanimity, as Geshe-la was saying earlier. It's the idea that you first imagine in the mind's eye, visualize a mountain, and then you're invited to become the mountain, so that you have a very stable base, you are on solid ground, and that you are very tall, and you have a very good view of everything around you, and you are very old. So you've been around and you've seen everything. And it's a way of trying to cultivate a sense of equanimity, such that on a day that there is snow, that is just snow. I am not the snow. I am the mountain covered in snow. And if there's a forest fire, the trees are burning, but the forest will be renewed. I am an old mountain, and I have seen everything, and I can treat everything that arises with equanimity. We also have a visualization practice in our treatment, where individuals visualize a difficult situation, and they literally are invited to take this thought and place it on an object in the room. Take this memory and place it on this object in the room. And at the end, there is essentially a canvas or a tapestry where your entire emotional experience is laid out in a way that helps you relate to the percepts of mind more readily. And then finally, we have a visualization practice, which is at the end of their mental training exercises, where we try to teach them ways of reappraising the percepts of the mind. So in this practice, we call it the meditation on courage and compassion. They are invited to visualize times when they were scared and there were other people who comforted them, and times when they comforted others when they were feeling scared. Likewise, there are practices where they visualize feeling very self-critical, and then someone like a mother or grandfather comforts them and makes them feel okay, and another visualization where they are offering these sentiments to others. And the fruit of this practice is to develop some kind of slogan or statement that they can use as an antidote the next time they find this quality of mind present in themselves. So I guess since my time is short, I did not present the data to this project, but we have very good data to suggest that the rate of improvement of our patients is quite good. It's better than the standard treatments, and we're very encouraged by these findings. And now we are in the process of moving on, trying to understand whether adopting these practices produces changes in the brain that are hypothesized to be part of their condition. So we're in the process of doing an fMRI study in New York City, where we are delivering this treatment with these practices and seeing whether there are neurobehavioral changes that are hypothesized. So thank you.
nga se shi chenyi de son sketchum ton so tan ni ji seng de ne kan ji le min ju res na ni ji seng min ju sat ni yo res ni ji chimbo se ya ji da ni ji cheme seng de ni ji chimbo seng de kan ji la se res na ene sinje thamje la thamje ge dunge la mi ne te trin de ji la ni ji chimbo se go re ni ji cheme seng de sinje thamje ma yin ba ene sinje kala kansam ji la mi ne ti ge dunge de trin de ji la ni ji cheme se go re 지금 니지 생에 딘디지란 주고를 마도지게 에네 가인 사질라 에네 니지 미타샤네 남베 준타는 니지 차고 말했대 근데 인자 단다게 란라 니지 생에 데 나테 바이나 에네 란 진진 제바 에네 란이 다종 제바지라 고그레스 딘디지라 고그레스 에네 자사 제모 샤왈레게 슌주난 숨바나 지금 있나 에네 센수 투슈 마토바 투슈 마베 치시 샤선 송요레 내가 나지 개와 젠나 냥라 이세는 냥 나야 냥메샤스 그네 쳔베 타바이 센지 람보 탐타나 에네 동에 탐지 세와 셰송요 띠 던다데 카레스나 간다 센송구레스 라닝 센송투나 에네 동에 세투에 데와 두투구레송 던다띠 에네 아나 센송알라가 지다 야나 란친지 셀라마도 띠 니지 셀라나 남베 준다나 니지 차그마레스테 에네 게 저와데 카레인스나 단다 에네 시스포베 세네세난다 에네 생게 세네세난다 생 동에데 네 간르스는 중요했으나 근데 라니 사나 땅다 만디네 사나 노트지 땅네 다 남베 중에는 더자 시당나서 보셔야 요르데 계시 드림 시무고치네 생 사나 노트 섭지 땅네 근데 노트 틀라테네 에네 생 나사도 서버레 근데 이제 겐 코너서 세네 주고 여자 에네 생 나사티 사나 노트 간르질라테네 생 나사도 중고요 바디 신주진 하고 봐 있나 에네 문에 그다 펜토야게 갈수고 다 콜라로자스 남도 콜라 ene youtube ji nge rag re sang du den yin zang gen quran su shinju ne ene son no ju khande ji ton ne sen ne ndam re yoro sen ne ndam re yoro sen ji ma re sen ne yung tang yung hu mo mo yor den yin za son no ju de la den ne sen ne dun jung yo ba son no ju de sho ne sen ne dun jung yo be ge tin de shinju gu ene she to chung yor yo ma res ene nge de shu.
I have a question, but before I ask this question, I would like to say something about compassion. Because since you are using this term compassion and you are having this kind of compassion training programs, so it seems that what you are talking about as a compassion is not a compassion according to our tradition. When we talk about compassion, we can talk about two different types of compassion, like the great compassion, which means your compassion is directed towards countless number of individuals, and we have, I think, a limited compassion. That means your object is towards few individuals, and so it seems that the kind of the compassion that you are talking about is, for our point of view, is kind of to some extent negative, self-importance kind of mental state or training. And so I think that with this kind of mental state or kind of training, you may not going to achieve a calm and happy person, because according to Shantideva, happiness has to come from controlling your minds. So if you're giving too much importance to your mind or your self, then you're not controlling the mind. You're just aggravating the mind itself. And so that's my kind of comment and my thoughts. And then my question is that you have talked about these different types of emotional problems and mental problems related with emotion and anxiety. So in our tradition, when we talk about any kind of mental diseases, we have to, we try to find what has caused that mental state. So, and after you have recognized the cause of that mental state, then we try to cure that mental state. So when you have this kind of mental states like anxiety and depressions and different types of anxieties and depressions, before you try to treat them, do you have any kind of practices or programs to try to recognize what caused those problems?
Thank you for the question. Thank you for the comment on compassion. Actually, I agree. I agree. Historically in the West, treatments, whether it's medication or psychotherapy, focused primarily on reducing the symptoms that the individual experienced. In some instances, there might be a very clear external cause for what led to the suffering, and sometimes simply solving the problem externally was enough to make the symptoms go away. For a lot of people, this approach is exactly right. Managing the symptoms may be sufficient to reduce their suffering, but even with traditional Western treatments, the rate of response may be 60%, 70%. So there's a big number of individuals who have no relief from their suffering. We actually agree, and this is why we are beginning to use neurobehavioral profiles. We are trying to isolate aspects of individuals at a neurobehavioral level to see if we can find a specific antidote that normalizes this deficit. The deficit might have been caused by something external, an event in their life, but it has left a residue or a scar in the body, in the mind, in the brain, that we need to find a specific tailored antidote. And the approach that we have taken, is that these individuals have a very unquiet mind, and we thought that beginning with practices that train attention would strengthen a compensatory muscle, if you will, that will then make practices of quieting the mind more effective after this foundation has been established.
So since you have tried different contemplative methods to cure different types of emotional and anxiety disorders, so from your research or from your experience, which kind of these methods are more kind of precise or more beneficial?
Well, thank you for the question, Dolma. I don't think Western science knows this answer yet. The model that I have shown you is still a model, and we know that the aggregate of these practices helps reduce the symptoms, and we know that they have achieved a durable treatment response. The goal now is to systematically see whether we're getting improvement with, say, attention practices only, and then attention plus these more cognitive elaborative practices after. I believe, given my knowledge of these patients, and I hypothesize this is why some of the self-compassion work may have been less effective in the PTSD patients, is that the minds of these patients with these misery disorders are not yet ready. They're not yet moistened to the possibility of visualizing, imagining their suffering, and then putting them to bed. And we may have to teach more attention practices, because that will strengthen the mind to then take on the percepts, the memories, the visualizations of things that are so painful.
아니 가르세나디 타탄다가 곰게발라티니 아니가즈트 다 심거 심네 포데니 마부질라니 펜토바요레스 다도 지금 심지기지니 기도된데 송대야 될라니 나라이나 다티 나완로슈 정시 가르세나니 ngazu nomba sangi begani chiga nalata gumse ate ne shita ta jachim buchi gum gyatang garamba mabuchi yorwa inaya te karsena ngazu chi mui chimbu chi chita ta chi tawadang thaji kembi goma toya se ro teni chimbu chi chita gum gyabde ya chi mato ya chi sim deu mundu sim kiu mundu chi nagandu se ro teni ki chita gum gya teni da phajir yang teni chetum ngini gum gya teni me an ro chi rewa ta chida tela phintoya da yong yor ta karsena ta ngazu nyangji gomyari ta gom kandi jigi bayna chata khola thartak gyo ta nikup gyo ni ja ko re teni songza ta nikup gyo to na teni phintoya ma bu ji yong yo ra ta ina ya ji denchang ne ji la gomna ani dini dini ji gomna phantong de ji do se ya teni ga ni shimji ji ya ta teni gi nyapsu ji ya de phakir ta ngazu namba sa ji na la meyan ro ji cha de go re teni songza khizu ti ya denchang deni deni la ji gomna phantong deni ji yong do se ya teni nyapsu ji ni deni ji sha ji 요제 텔라니 온 예고 동송생가 이나라 아니 따셔다 ता सिमसुर तांजिंची वाला तेनी यानी करसेना सिमट्री देवा ता जोलाया करे सु चितपची गयो रे लापसोंगा तेनी सोंता छता सिमट्री देवा ता सिमने योवा ता जोलाता 지금 유 mambu지 여기라 다 छता 간디지 김바에 나가서 치 간디지 김바나 기치 mambu지 라티니 종고요 또 코란 종사가 기때 가래임바데 닌진 니존이 아니 따때 카피고니 지와야나 저당 판도 치와 용고 결상 건도라 이나야 저당 다 현지 또 디르도 파 곰디잖아요 셈수리 야가 쇼데 몽부지 공플란도 디잖아 다 저당 셈수 당진 당 셈수를 멤버 마치가 또 펜다 팽고 있기로 이나야 저당 셈수 당진 지야라 아니 다 저당 셈수를 그런 바 몽부지 요라 다 가서 넘바 산지 이종 지와야나 다티 야타 저쪽 몽부 송고요라 데니 송자 저당 셈수 당진 지야라 아니 야 셈수를 멤버들이 막 가니니 셈수를 야가들이 야지 땅에 들이 인기로 왔더니 송자 기존에 지금 셈수를 뜻하는 일이 있잖아 아니 지금 셈수를 그런 바 지금 가고야 가라가라 증기든 지고요 아니나 아니 야지 땅고야 가라가라 증기든 지고요 아니나 아니 티치트인
In Buddhist traditions, when we talk about meditation, we do meditation and we talk about meditation for enlightenment. So normally we don't find or people don't do meditation for curing diseases and for temporary happiness. So, but for any kind of practice, we can talk about long time and temporary benefits. So we can consider this as part of the temporary benefits for meditating, and it's kind of a new thing for us, and especially when you talk about benefits of meditation for just a certain period of time. Like if you do 1 week of meditation training, you will get this kind of changes in the brain level and like physical level. And these things are new to us, and so I'm happy to hear this kind of information from you. And then also when we talk about emotional regulations in your presentation, any kind of emotions, whether it's positive or negatives, we think that it has causes, its own causes and conditions. And in Buddhist tradition, when we talk about emotions, they can have hundreds of emotions, and some of them are positive, which we should try to acquire, and some of them are negative, which we should try to avoid. So from your tradition, do you have certain emotions that you have, you need to, or you should eliminate it or avoid it, abandon, or and there are some emotions which you have to motivate it or cultivate it? And yeah.
I'm glad you mentioned the idea from your tradition of short-term and long-term benefits. I think one of the misconceptions that many Westerners have about meditation is that one practice, one day of sitting, is going to have an immediate benefit. And you know, all of you who are contemplatives understand that it is the cumulative effect. I mean, it is, what I say to my patients, it's like going to a gymnasium. It's like training for a marathon. And these Tibetan monastics are the Olympiads of the mind, because they have practiced hours and hours and hours. So I'm pleased to hear that you think in terms of the short-term and long-term benefits, and I agree that Western treatments that are infused with mental training are trying to cultivate these short-term benefits. In terms of whether there are any emotions that must be strengthened or must be avoided, strengthened, yes, because certainly the positive emotions we want to strengthen. But I can't say that I would recommend eliminating all the emotions. From the Western perspective, particularly from a functional perspective, each emotion has survival value. If I taught you to eliminate, if there was a practice either from your tradition or from a Western tradition which eliminated fear, and you're walking in MacLeod and you see a monkey or you see a lion and you no longer have fear, then you may choose to interact with the lion and it eats you. So there is survival value for fear. And there's survival value for sadness. It's a way of reflecting on the loss. It's a way of putting the loss to bed for good. Some people have difficulties with these emotions. So from my Western perspective, I would not banish any emotion, but I would like to teach everyone healthy ways of relating to each and every emotion, but also to strengthen the ones that nourish us, and put the other, and only work with the others when there is some stimulus in our life that requires us to draw our attention there.